So now you came in and you said, I'm so dizzy, unsteady when I walk, my head is throbbing, and that just started this morning. So I'm going to ask you 4 questions about dizziness and unsteady gait and associated symptoms. So the dizziness started this morning, and you feel unsteady when you walk. Does it feel like the room is spinning, or does it feel like you are spinning?
The room.
The room is spinning. Any pain or any headache or sensitivity to light?
Yeah, kind of.
A little bit. So how would you describe that headache?
Throbbing.
Throbbing. And then you'd say, where would you say it's located?
Behind my eyes.
Behind your eyes. And did that start when the dizziness started?
Yeah.
As anything to make it better?
Not really, no.
Anything making it worse?
The lights on.
The lights on, so sensitivity to light. So we'll definitely dim the lights for you then. And how would you rank it on a scale of 1 to 10?
7.
7. And would you say? And you said it's pretty constant.
Yeah.
Okay. All right. So 7. And what would be your goal level of pain?
5.
5. All right. So what are other questions that we could ask for dizziness or unsteady gait?
What's the subtitles?
Do you get dizzy when walking?
So, and she had said she gets dizzy when walking. We could say, how else does this affect your life? Are you able to help yourself clean up, or has it affected some of your activities of daily living?
I can still do it, but it's annoying.
And does it take you a little bit longer because you have to be a little
Yeah.
more cautious? Okay, that makes sense. Has it been making you nauseated at all?
After a while, yeah.
After a while, any inner ear ringing?
No.
No? Okay. So that was 4 questions. So then carotid artery palpation, so one side at a time. Beautiful. Very good. So carotid artery is equal on both sides, regular pulse rate and rhythm. So then I'll help you stand up. So first I would like you to take your heel on your shin and draw a straight line down. Good, actually I may have you lay back down to do that. Might be a little bit easier. Sorry, I apologize. So go ahead and take your heel to the top of your shin and then draw a straight line down. Good, and then switch. So what are we testing for here? Yeah, good. Cerebellar function. Okay, very good. Now I'm going to help you sit back up. So now I'm going to have you extend your fingers out to each side. Go finger to nose. Good, and again. Good. Now I'm going to have you point your finger to my finger, then to your nose. And again. Good, and with the other hand, finger to my finger and finger to your nose. Fantastic. So that's finger to nose, so also checking cerebellar function. So we're going to assess your gait again. So if you could go ahead and take a few steps that way. Good, so gait is nice and smooth. Arms are swinging in opposition of legs. And when you turn around, if you could do heel to toe for me. Good, so balance seems good. Very good. So how's the dizziness feeling? Still there?
Yeah.
Good. Or not good, right? All right, I'm going to go ahead. We'll have you sit down. Can you go ahead and smile for me? Can you frown? Puff out your cheeks. Can you raise your eyebrows? Can you go ahead and close your eyes? Good. Now don't let me open them. Very good. So what cranial nerve is that checking?
7, 5, and 7.
Yeah, 5 and 7. Good. So then I would grab a tongue depressor.
Yeah, that's a good question.
So, all right, so go ahead and say ah. So uvula rises with phonation. So then I would also press down the tongues, check her swallow. Can you go ahead and swallow for me? Good, I don't see any excess saliva. So we could also check her gag, but I'm not gonna do that to you right now. So and what cranial nerve is that test? Beautiful. And then lastly, we're going to, so since I put that in her mouth, I'm going to do hand hygiene again. Lastly, I'm going to do Romberg test. So I'm going to have you stand up, feet by your side, arms by your side. I'm going to have you close your eyes. Good, so we're going to be there just in case they fall. She's not really even swaying. Swaying would be normal, but positive Romberg would be if the patient's falling. All right, very good. You can open your eyes and sit back down. So I'd make sure the bed is lower to the right height. So I'm gonna let the doctor know my findings. He'll probably be in to see you in about a half an hour, and I'll be back in to check on you. Hand you your call light. Is there anything else I can get for you at this time?
No.
All right, thank you very much. And hand